So atrial fibrillation is a common heart condition whereby the top two chambers of the heart, or the atria, in Canada, over $800 million are spent on the care of patients with atrial fibrillation each and every year, both for hospitalizations, emergency room visits, as well as surgical interventions. Now, one of the most feared complications of atrial fibrillation is the development of a clot that can then travel to the brain, causing a stroke. And this can be effectively prevented by the use of blood thinners. In the past 60 years, the treatment of choice in these type of blood thinners has been warfarin, or more commonly known as Coumadin. And there's a significant level of comfort with respect to its use. In the past 3 years, though, there has been an advent of new blood thinners that have come onto the market. And many of you may have heard about these, such as Pradaxa, Eliquis, and Xarelto. And these have expanded the choice that physicians have in preventing stroke in patients with atrial fibrillation. And atrial fibrillation affects about 350,000 Canadians, 3/4 of whom are aged 65 and above. Here at Queen's, we're very unique in that we're the first satellite site of the Institute for Clinical Evaluative Sciences, which allows us to combine the patient-level data that we obtain locally with the population-based data that we collect provincially, enabling us to combine these data to enrich our sample and to provide important answers to our proposed question. We have been very fortunate to receive some funding from the Canadian Institutes of Health Research to support our project. The support that we have locally is essential to ensuring the highest scientific rigor so that we can have answers with confidence to these big questions. We have a fantastic team led by a group of clinicians and researchers, including Drs. Chris Simpson and Dr. Anna Johnson here at Queen's, and it's been a privilege working with them. On behalf of the grant team, please accept my most sincere appreciation for your investment and, more importantly, your faith in the research that we have proposed. Answering questions on health that matter to Canadians is what motivates us each and every day, and I appreciate the opportunity to do this.